United States is ready to fight Ebola as much as they're ready to fight ISIS. So it shows how serious the United States is making the issue of Ebola. Not saying that, well, it has not got to our borders yet, so we don't need to worry about it. It's a global problem.
I am Father Peter Konteh. I'm the Executive Director of Caritas. Caritas is the development wing of the Catholic Church in Sierra Leone. And I'm from Freetown, from Sierra Leone, the capital city of Sierra Leone, Freetown.
My name is Ismael Charles, and I work as the In-Country Programs Manager for the Healey International Relief Foundation, and I am mostly been supervised by Father Peter Konteh.
Now, you were both invited to Washington, D.C. this week to testify before the Joint Senate regarding the Ebola crisis, and you were invited by Senator Tom Harkins. Can you speak a little more about why you're here this week and what you hope to accomplish?
Basically, the essence of actually we are speaking of out there is to bring a human face to the whole Ebola crisis, and actually not just looking at the effect of the Ebola itself or the health-related hazards, but also the fact that it also boils down to socioeconomic challenges, which is also killing a lot of people, not just the virus itself, but also the socioeconomic issues and the poverty and the hunger and other social challenges that it has actually posed to a country which has a very high number of illiterate people.
Now, the Ebola outbreak has been ongoing since May of 2014. Do you think that since that period of time it has gotten worse, and do you think that any international aid has helped at all to kind of combat the issue?
Well, certainly it is worse, because initially it started at the border. The Ebola we have in Sierra Leone came from Guinea, and it started in a small community, and at that time our structures were not ready to handle the crisis. The health systems were not in place, and the awareness among the people, there was denial, and so we started struggling with what to do, and there was no direct consciousness and awareness even from the point of view of the international community, knowing that initially Ebola outbreak were limited to smaller communities. This is the first time Ebola is now in the urban area. And so there has been a rapid spread, particularly the past 3 weeks. We've had an increase in the case because it is now in an urban setting, and Ebola is transmitted by touch and by contact, and the response has been very gradual. It's this past week that it has overblown, and we've got some attention that we need in this situation.
Now, I noticed that there was a 3-day nationwide lockdown in an effort to kind of halt the effect of Ebola. Now, do you think that this lockdown has jeopardized the trust between people and maybe the healthcare providers?
Well, certainly not from that perspective, because the essence as put forward by the government is to ensure that the people stays indoors, because since Ebola is contracted to bodily contact, and so restricting the movement of people for a specific number of days will essentially reduce the possibility of having new infections. But then issues of trust and mistrust have been a very big issue even before the 3 days lockdown, which actually started today and it will end on Sunday. The issues specifically have been cultural and beliefs, and also political issues. When it actually started in Kailahun, there were tendencies, people started talking about the issues of, they think the government, because we're going to have census, population count, basically in December. So people thought it was a strategy for government to reduce the number of people in that particular district, which is normally the stronghold of the opposition political party. So that was one of the issues. And then moving forward, people start to think that there are issues around witchcraft. Some people say it's a witch aircraft that have actually crashed, and that is killing a lot of people. And all those difficult situations came about, and then it went to a point when they say because of the ways Ebola patients have been buried, they are normally been isolated, and then once you become a victim, you die of Ebola, they automatically will bury you in a very different way. So, and they bury you most times in the absence of your family members. And so people decided to think that if they bury you behind your family members, that means that they're taking some parts from your inner parts. And that's created a lot of confusion along the line. But then in reality, it's also about the situation where the virus is very new, and everything about the response, the mechanisms, and the understanding was not there. So, and of course, the health infrastructures was very weak before even the outbreak. So it's only compounded the problem, having such kind of not very strong healthcare systems, not very strong health facilities, compounded the problem. And so also the fact that Sierra Leone is a country that has 70% illiterates. So you can imagine a situation like that, how to get those people to understand that it's an outbreak and it's a virus and it kills, you know. And that's basically what we've been doing as part of our work. We've been trying to raise the awareness and do a lot of community advocacy and social mobilization, and get people to understand why they need to know that this virus transmits through those mediums and those means, and also why they need to believe that Ebola is real. It's not a myth. It's not a magical thing. Mm-hmm. It is a real disease that exists.
Now, do you think the volunteers who are on the ground and the healthcare providers who are going door to door to try to educate people about this, do you think that they have adequate training to do so?
Well, incidentally, we are one of the organizations that have volunteers that are out. We did a couple of trainings with them. Incidentally, these are the same group. 2 years ago we had cholera outbreak. These are the same health volunteers that we use, so they had the basic. And we are yet to see the result of this shutdown, whether it is positive or negative, or it is fruitful or not. But they are training off, to go out and counsel and talk to people. And we believe that, we will have to judge at the end of the 3 days, because there are also downside of all of it, in as much as the intention is positive. Initially, there were a lot of reactions when the selection of the days, it was Friday, Saturday, Sunday, meaning that the Muslims, that was the day for their prayers on Friday, the Adventists on Saturday, and the Christians in general on Sunday. And so they are saying that they were excluded in the decision of the selection of the days that, were selected for this exercise. But we tried in various ways to educate and to let people understand that it's for the general good. But, definitely there is it's going to affect the people, because people live on a day-to-day economy. They don't have big savings, so they need to go out every day to sell their product and get something to eat. So keeping them 3 days, I'm afraid that it's going to be counterproductive, in as much this is a good intention to track those who are infected, and the other fear personally that I have is that, even if it's successful to identify those who are infected, we don't still have the capacity to handle all of the cases that will come out.
Right.
That's why we need an urgent intervention. And the intervention that we're asking for should be regionally based, because there's no point in giving Liberia over support, or Sierra Leone or Guinea in isolation to the other, because, saving one, the infection, people still moved. Our borders are very porous, people are moving in and out. So whatever intervention that should be given should take a regional dimension, in which, it's no matter of our colonial or historical ties, but the support should be given for the region, so that this issue is combated once and for all.
Mm-hmm. Now, can you speak more about the Healey International Relief Foundation and what they are doing to aid in the effort to combat the Ebola crisis?
Basically, the Healey International Relief Foundation is a foundation that is based in Lumberton. It was founded some 12 years ago, and purposely to support post-war countries and socioeconomic countries, socioeconomic challenges. And it has been providing lots of relief and rehabilitation efforts and supports and trainings, and also other programs on the ground. And over the years, the foundation has been supporting a couple of projects, and one of the newest projects that we started working on was to rebuild and re-establish the National Health Organization, which was going to target about 40 clinics across the country. And the essence of that was to strengthen the health systems, which we already know was very weak. And Ebola has only further compounded our problems already. And the idea is to build those clinics and set up a mechanism where you can have supplies. So you do due diligence once you get the supplies coming into one hub, and then we can supply these different clinics across the country on a basis of demand. So we don't supply those materials or medical supplies or medicines or drugs or whatever to clinics that don't really need them. And that was the idea. But so we're still working on that. And that's one of the biggest projects. But also prior to that, the foundation has supported the Sierra Hospital, which was being run by Caritas Freetown. The Sierra Hospital was a very strong hospital that was providing healthcare services in the country. It's based in the southern part of the country. But along the line, it was being destroyed during the rebel incursion, and then the European Union provided funds for the rebuilding of the structures and rehabilitation of it. But then the foundation actually came in back because it was just the structure, but then the foundation came in and brought in medicines, machineries, and other kind of medical supports. Containers, loaded containers from the United States to this hospital, so that the hospital will match up back with the standards. And currently, as I speak, Sierra Hospital is a hospital that is established about 250 inpatient beds, and it's up and running. Though it's also prone to the risk of Ebola, because you have patients keep coming in on a regular basis, which you're not sure what sort of sickness they're coming on until you test them. And also, the foundation has been supporting the Fatima House of Lights project, which is basically supporting girls who been considered to be battered goods because they were being raped or taken away by the rebels during the rebel incursion, and those who live mostly in slum communities and living in very poor circumstances. So the foundation provides support through Caritas Freetown to train these young women and girls in different skills so that they become self-reliant. Because the core program approach or principle of the foundation's interventions are basically to ensure that we develop systems where they can be self-sustainable, not to continue to seek for handouts and continue to support programs, but then have programs that will effectively run on their own after a given period of time. And that is even the clinics that we're talking about. We are thinking of an idea of establishing an IV plant that will form a social enterprise aspect, which will provide resources to support these clinics once the clinics have been established. And also the foundation supports the St. Stephen's Home for Amputees. This seems to be the forgotten few. People who've been victims of the war, their hands were chopped off and some of them their legs at different points, long sleeve and short sleeve. People who are very familiar with the Sierra Leone conflict will understand what it means. But when they say the short sleeve, they chop your hands here, and when they say long sleeve, they chop your hands from this point with machetes. And it's quite very horrific, but then these people are there. We've not been able to provide for them generally as a country. So the Healey International Relief Foundation is trying to see how we can put together support to support those people. And furthermore, the foundation supports Caritas Freetown in managing and supporting the St. Mary's Children's Home, which is an orphanage that was established by Father Peter some 12 years ago when during the conflicting days. And a lot of war orphans are there and abandoned children, basically. So the foundation is involved in quite a lot of number of things, both pastoral and non-pastoral projects, because we try to set the dimension of our different projects so that we don't just target the pastoral aspects, but also we target the general society. Whether doesn't matter what's creed, what's religion, what tribe you're from, we make sure that as long as where the need is greater, that's where the foundation focuses at. And that's the same strategy that Caritas Freetown is working with. So it makes the partnership a very effective and very common one.
Now, in regards to media coverage, do you think that there is enough coverage in the area of Sierra Leone in regards to Ebola? And what do you think needs to be put out there?
Well, naturally, in the United States especially, there are more attention and more coverage on Liberia, because we can understand because of the historical background, you know. But the fact is, like Father Peter rightly pointed out, we always give a scenario if in a situation where you have two couples, a couple and the husband and wife, and one of them got infected with STDs, and you treated one, you didn't treat the other one. There is always likelihood that the one you didn't treat is gonna pass over back the disease,
right.
And that's the situation between Sierra Leone and Liberia. Sierra Leone didn't have Ebola. It actually slipped in from Conakry, from Guinea, and then it got to Sierra Leone, and to Liberia, and then to Sierra Leone. And so it's the same with every situation, even the conflicts. When we had a civil war, it was in Liberia that the civil war was, and then later on spilled over to Sierra Leone. So it's a situation where we have to look at both programs in a holistic manner, and the intervention has to be, you know, comprehensive in a way that it covers all the affected countries. But generally, we have little or sometimes not even any information or any related issues about Sierra Leone. It's mostly about Liberia, especially in the United States.
Now, Mr. Konteh, in regards to your position, can you talk more directly what you do as executive director and what you hope maybe in a few months or hopefully the next year to come from the Ebola crisis and hopefully, I don't know, moving forward?
Well, as the executive director, I have the role to coordinate things, and the relationship between the foundation and ourselves. I could use an analogy like a car and a fuel. So we get support from the foundation to fuel us to implement our goals and our objectives, which align to the same belief in helping the less fortunate and the less privileged. Caritas is an household name in Sierra Leone, especially in crisis, and we target beneficiaries who are the poorest of the poor. Already Sierra Leone is a very poor country, so we look for the poorest of the poor, and that's our focus and that's our aim, regardless to the creed. You know, many times you see Caritas is a faith-based, but we work, Sierra Leone, there is a good harmony between Muslims and Christians. In every institution you find Muslims and Christians, so we work together to, you know, alleviate the suffering of our people. We've been reflecting and coming with several strategies. Prior to Ebola coming to Sierra Leone itself, when we had Ebola was in Guinea, we started our preparation, we started little sensitization. When we actually had Ebola, we continued to sensitize, and we are already putting strategy in place for post-Ebola era. We have, fortunately, in our organization, people who are trained in counseling, because we dealt a lot with the ex-combatants and those, you know, affected in the war, and so we are trained counselors. So already we are retraining them so that they are, you know, au fait with new strategies to address the Ebola, post-Ebola era, which people are going to need a lot of counseling because many people lost entire family. And so in situations where you find difficulties like that, the target group would be children. So we have an experience of working with orphans for many years, and so that experience will be translated to us handling these Ebola orphans. In their case, it's very sensitive because of stigmatization. People will stigmatize them. Even locations where we put them, we have to be quiet about it, because otherwise the communities will feel you are importing Ebola to them. So we've been thinking a lot on how to address stigmatization, counseling, and provide love and service to those who are badly hurt in this situation.
Now, Mr. Charles, when you testified before the Joint Senate hearing this week, you know, what is the biggest takeaway that you took, and what do you hope the outcome of you speaking about, you know, the problems with the Ebola crisis are?
Essentially, we were very impressed that the House of Senate seems to understand exactly the challenges in Africa, and so bringing a human face to the whole story helped to enhance in-depth understanding on the situation with the Ebola crisis, and not just the Ebola crisis, like I initially said, but also the socioeconomic and other effects that it's actually have on families and children and women especially, who mostly suffer in terms of crisis stages. But then what we believe
what we were convinced about was the fact that we could see how compassionate the House of Congress was, very much compassionate, and they promised to make sure they would do what they can. And one of the Senator Moran specifically referred to Ebola, referred to the situation that the United States is ready to fight Ebola as much as they're ready to fight ISIS. So it shows how serious the United States is making the issue of Ebola. Not saying that, well, it has not got to our borders yet, so we don't need to worry about it. It's a global problem, if not handled very well, because on last Saturday we were in Sierra Leone. On Sunday we were in Sierra Leone, but today we're here in the United States. And if we were Ebola positive, we could have infected a lot of people. So it's a situation where we need to find ways of resolving global problems from the smaller stages before it gets to a point that it goes out of control.
Okay, well, is there anything else that either of you would like to add today before we conclude the interview?
Well, we want to thank the United States government and other international communities that have been supporting the country and West African countries specifically, and also re-echo that when the United States think about Sierra Leone, also not just Liberia, we want to thank the people and all of you guys who are actually giving us the opportunities to pass on the messages and raise the profile of our countries and raise the realities of the situations on the ground. Thank you very much.